It's just because you have to breathe in before you breathe out. Have you ever tried breathing out without breathing in? I wonder, have you self-adjusted today yet? Probably.
Yes.
Yeah, okay. It's interesting. You feel pretty good actually down through the lower aspects, which is the region that we're typically able to self-adjust the neck in. But I am still getting tension at the very top there. So relax as if my hand is a pillow, okay? So that's an occipital adjustment, a little bit different than the other neck adjustments you guys have probably seen me do on the channel here. Gabbi, good to meet you today. Thanks for coming in. So Gabbi is the fiance of another patient that was just in, hence you might recognize the shirt. But Gabbi is in today with a couple of, well actually I'm just going to let her talk about it because she said like everything's sore. So Gabbi, why don't you kind of tell us what you're in today for?
It's mostly upper back,
Okay.
near my neck. So me and my fiance, we go to the gym together, and a while ago I was doing chest press, and I just dropped the weights and something like pulled here.
Okay.
So now I can't fully turn it this way, like my head.
How long ago was that?
I'd say about like 3 or 4 months ago.
3 or 4 months ago, and it's still like that?
Yeah.
Okay.
So I didn't know it did that until like I crack my neck a lot, so I can crack it this way, but I can't crack it this way anymore.
Interesting.
So then I just kind of associated it to that injury. So yeah. And then other than that, that's...
Have you seen anybody else for that yet, or no? Okay, so
Never.
exciting,
Yeah.
right? So the one comment I'll make on that is that I get a lot of people in here who are self-adjusters. They'll ask me like, Adam, is it bad to adjust yourself? Like, what's going to happen? There is an old wives' tale that says if you adjust yourself, you're more predisposed to developing arthritis and whatnot. That's untrue. That is not the case. Now, the one thing about self-adjusters is that there are definitely parts of your back, of your body, that you're able to self-adjust. Okay, I self-adjust basically all the time. My neck, my thumbs especially, because I work. But the one, I work with my hands. The one issue with that is that there are different regions of the body that just physiologically you are not capable of self-adjusting. Okay, and I compare that to asking a patient like, how well can you massage your own back? All right, there might be like some regions that you can get pretty good, but like good luck getting your rhomboids as efficiently as you're getting your quadratus lumborum, for example, right? Now, if you were to continuously self-adjust, but you're not releasing also the occipital region, for example, which is the very top, or the CT region, which is the very bottom, what you could be doing is promoting hypermobility in those regions that you are able to release, and increasing the amount of stiffness and tension and sometimes even pain that passes through those areas you're not able to release. All right, it's not all doom and gloom though. That's why chiropractors have job security. All right, we're able to get those regions because sometimes you just need somebody else to do it. All right, and it sounds like that might be the case now because you can't get your head to the left.
To the right.
No, you can't get your head to the right, but like when the cracking goes, you can. Which side can you get and which side can you not get?
I can do it this
So
way,
she's
but not...
so when she rotates like that, she's able to get her right side, but she's not able to get her left. Okay, can you do that one more time? Let me just make sure. Slowly, perfect. Okay, yeah, that should be.
And then not this.
Okay, so we're going to help her out today because I'm fairly confident I'm going to be able to get it. Again, external force, as well as the upper back there. It sounds like she might have strained a trapezius or a levator scap. We'll figure it out. Probably both. Upper back. Did you say anything was going on with the upper back specifically?
No.
Not too much.
I mean, I did have a job where I was like vigorously like with the fried things. That definitely
worked up some tension there. Okay, so
Yeah.
again, the traps are a big muscle. They do span the neck down to the upper back. We're still going to examine it. Do you get anything in the lower back or not really?
odd time.
Off and on.
Yeah.
Have you noticed any kind of rhyme and reason to it, or?
No, I just crack it.
You just crack it. All right, well, we'll check that out too. Then, if that's something we're self-adjusting. So today, are there any other concerns or anything else that you want to bring up?
I do have bad posture, so I have a bit of a, what is that called? Buffalo hump?
Yeah, buffalo hump. That's the
Yeah.
term for it. It's not the most flattering
I
term,
know.
but it is called a buffalo hump.
So I do like
the chin
chin
tucks.
thing, but it's not flattering either.
Who showed you the chin tucks, or where did you get that word? Did you Google around and find it, or?
Talk.
TED Talk. Hey,
No, TikTok.
Oh, that's a TED Talk. I was like, hey, you know what? As far as like academic and health advice goes, TED Talks are probably okay.
Yeah.
TikTok is not.
Yeah.
All right. TikTok is the opposite of TED Talk. Wow, that could be a thing. TikTok versus TED Talk. I feel like that. I'm gonna talk to Serenity about that. But yeah, no. Okay, so That's actually correct. It is called a buffalo hump, and the chin tucks are supposed to help that. We'll take a look at it too, okay? With buffalo humps, we either get them due to posture or we get them due to a dorsocervical fat pad. Okay, I don't know if you've heard of that before, but it's kind of like a lipoma forming on that region. Again, unflattering. That you can keep doing chin tucks. That might help a little bit, but like at the end of the day, that's something you would actually need to explore surgery for if it is a formed fat pad. It's pretty simple. You just take it out and you're good, right?
Is it related to, like, if I do have something wrong up here in my cervical spine, like if I stretch it, is that helping the bad posture?
So you doing a chin tuck there, yeah, it should. Okay, yeah. So any kind of movement too, a lot of people get hung up on this idea of like, oh, is my posture bad? Very few people actually have quote unquote bad posture. What they have is a stationary posture. Okay, again, I already mentioned one old wives' tale. There's another one now where like this is bad posture, the shrimp, right? I think that's what the fiance called it, right? And yeah, this posture gets demonized a lot because it is the posture that we kind of resort to when we've been studying or working at a desk or whatevering for a prolonged period of time, right? There's actually nothing wrong with this posture. The only thing that's wrong with this posture is that we remain in it for too long. It's the default one that we go to, right? So people say that like, oh, well, this is the perfect sexy posture. This is the one that you should have. If you were to remain in this posture for hours on end, similar to like how you probably remain in this one, you would develop symptoms as a result of being in this posture for too long.
Right.
So it's actually more important to continuously change it up and keep movement involved in the day. That's the thing that will help your bad posture more than just the chin tucks themselves.
Okay.
Don't get me wrong, do the chin tucks. Okay, it's movement, it's better than nothing, all right? But I think it would be even more effective if you were to get like a sit to stand desk, if you were to like schedule regular movement breaks. Like that's kind of the approach that I take rather than just like, hey, do this like 30 times every like however often, all right? Still do them, but there's more to be done.
Right.
Any other kind of questions before we get started here?
No.
No? All right, perfect. So what we're going to do today, we're going to do a physical exam, and then we're going to treat you. We're going to find ways to try to, well, first off, get you to turn further, okay?
Yeah.
Awesome. All right, so Gabby's focusing primarily on a neck complaint. She's not able to kind of get full rotation to the left as she is to the right, so let's confirm that. We're going to start by getting you to rotate your head as far as you can to the right for me. Was this the direction that's restricted?
Yeah.
Oh, okay, my bad, I got them mixed up. But no, come as far as you can to the right still. We're able to get to, you know, pretty far still. We're able to get to maybe like 75 degrees. No, as far as you can to the left, please.
Oh.
Yep, as far as you can to the left. Okay, here we're able to get to a solid 90. Okay, so she does still have a lot of mobility on that right side. But when we compare, we get about a 15... anything more than a 10 degree asymmetry, I'm kind of like, okay, maybe there's something there. If it's like 5 or less, whatever, doesn't really matter. But I can get you to look, bring your chin down to your chest, look as far down as you can. Do you get any kind of stiffness or pains back here as you do that?
No, but I did forget to mention one thing. When I do that, something like shifts here.
I actually felt that just holding here.
So
do that one more time? Yeah, okay. And once again, go ahead. Okay.
What is that?
So if you're able to reproduce it over and over and over again,
Yeah.
that's a tendon sliding over a bone.
Oh,
okay, so normal anatomy and not something to necessarily be concerned about. Okay? You know, people who have like really clackety ankles.
That's me.
Yeah, that's what it is. It's a tendon sliding over a bone. Okay, so it's not something to be concerned about. Normal anatomy for you. Okay?
Okay.
There you go. I'm gonna get you to look up towards the ceiling for me. Any discomfort back here?
No.
No? I'm gonna bring this further. How about now?
No.
No? Good. Face forward. Tilt your right ear to your right shoulder, please. We're able to get to about, let's say, 50 degrees. Tilt your left ear to left shoulder, please. We're able to get to further. We're able to get to about 60 degrees there. Good, good. I'm going to get you to give yourself a tight hug for me, please. Tight hug. Good. Rotate as far as you can to the left. We can get to 60 as far as you can to the right. We can get to 60. So that's symmetrical. Lastly, I'll get you to stand up for me. Please bend down, touch your toes. Any discomfort in the low back with that?
No.
No, come back up. Extend backwards for me. Like this. There you go. Any discomfort with that?
No.
Love it. All right, good job. We're going on your back now, okay?
Okay.
All right, so let's start down at the SI joints. Again, spine, sacrum, ilium, SI joints. Anybody who watched the channel should be very familiar with this anatomy by now. Those actually both feel pretty good. So let's work our way up. We got some tightness, I feel, on the right side of the low back as compared to the left. And then once we get into the upper back, it's pretty even on both sides as far as the tightness category goes. So Now, when you got that strain, remind me, left or right side?
Right.
Right side. Were you feeling it primarily up top here or more kind of here?
Yeah, there.
My guess is here because this feels like a rope. So, hey, I mean that as a compliment in here, by the way. So that is right where the levator scap inserts into the scapulae. Again, levator scap, we'll put a diagram of it up here. It's primarily responsible. It originates from the neck, connects into the scapulae, predominantly responsible for bringing the shoulder blades up. Now, if you're going for a maximal chest press or maximal bench press, and your pecs start to fail or your pecs aren't properly engaged, you're going to start hiking up your shoulders, okay? And how do you hike up your shoulders? You do that with your upper traps as well as your left scap. Now, the upper traps, they are a larger muscle group, so they are less likely to tweak out as compared to the left scap. Sounds like we had a spasm here. That kind of resulted in what we're dealing with now. So that's kind of my clinical hypotheses, diagnosis as for what went on currently. So, does that make sense to you?
Yeah.
Perfect. So you haven't been adjusted before because you haven't seen a chiro. We're going to try it today. So what I need from you is to take a big breath in. Oh, so well, actually, this is the way it's going to go, okay? I need you to take a breath in, and then I'm going to ask you to take a breath out. And when you breathe out, it's a like fast, like get that air out of your lungs, okay?
Is the breath in fast?
No, the breath in, you just take a breath in. Like, yeah, there's nothing special about that part. It's just because you have to breathe in before you breathe out. Have you ever tried breathing out without breathing in? Doesn't work, right? Exactly. All right, let's get you to take a breath in, all the way out. Good. Had a little bit of a release there. It's kind of subtle, but did you feel that?
I didn't feel it, but I heard it.
Okay, well, I hope the mic heard it because that was a really subtle one. But not scary, right?
No.
Good. I'm going to bring the mic over to this side because this is definitely where we're feeling it more. Alright, I'm just going to turn your head here. Good. Relax as best you can. Good, good. There we go. Mike definitely got that one. So that was right under the left scap, there, around T2, T3 region. Good. Solid release. See, for example, you wouldn't be able to get that one yourself, would you?
No.
Exactly. Is there something down here? Yep. 60% of the time, I'm right every time. I'm going to get you to just relax the shoulder here. Good. Nope, that's okay. Let's feel, how's the left scap on this side? Not nearly as bad, huh?
No.
Okay. Alright. Yeah, there's nothing there. Okay. Good stuff. I'm going to take this, and we're going to feel on through. So, let's see what we got. Now, I wonder, have you self-adjusted today yet? Probably.
Yes.
Yeah, okay. So this is interesting. You feel pretty good, actually, down through the lower aspects, which is the region that we're typically able to self-adjust the neck in. But I am still getting tension at the very top there. So let's see about handling that. Again, that atlas occiput region, difficult to get ourselves. So to get that, I'm going to get you to turn your head as far as you can to the right for me. Good, and then just drop the head in that position. Now relax as if my hand is a pillow, okay? Good stuff. So that's an occipital adjustment, a little bit different than the other neck adjustments you guys have probably seen me do on the channel here. See, it wasn't scary, right?
No.
Good. We're going to try lower down just in case my hands are lying to me. I'm going to turn to the left, drop the head as much as you can. Good. Yeah, no, nothing down there. That's okay. So around C2, C3 region there, some tenderness. Yeah, you don't feel as good lower down on the left side for whatever reason. You have to equally self-adjust. What are you doing?
I told you I can't crack the other side.
Yeah, I know. Oh wait, yeah, it was the right side you can't crack, eh? Okay, I'm gonna try that right side one more time then after this. Alright, turn as far as you can to the right. Good. Drop that head for me. Drop. Good. There we go. That one goes. Okay, let's see that right side one more time. Turn as far as you can to the left, please. Drop that head. Good. Whoops, don't want to bump the camera. There we go. My hands were lying to me after all. Silly hands. So to clarify, that was the region that you really haven't been able to move lately, yeah? Okay, good. Happy we were able to change that up for you just a smidgen. How was that? Not scary?
No.
Good?
Yeah.
Happy to hear. So, Gabby, usually while I do this with people, I like to ask them a question about themselves, and it was discovered that you have cats.
I do?
That you happen to like quite a bit, I imagine. So tell us about how many cats you got. 1 or 2 or 3? Two. What are their names?
I got Binu and I got Milo.
Binu and Milo.
Yeah.
It's not Tupi and Binu. No, but it's Binu.
No, we tried Tupi and it just didn't suit him.
He wasn't really a Tupi, eh?
No, we tried Simba, didn't suit him.
Milo's way better?
Yeah.
He's a Milo cat. What kind of cats are they? You don't know, eh? I thought you'd know. You're their owner.
They don't have a specific breed. They're just like short-haired domestics, but we saved their lives. So,
oh, well, good on you.
Yeah, one was gonna be euthanized, and the other was a stray, and he lost all his teeth. So.
Oh my god!
Yeah.
That's like foster kitties. That's so sad.
Exactly. That's why I love them so much.
But hey, you took care of them. That's good. You're a loving, caring mom, eh?
Yeah, with my cats.
And well, I mean, hopefully kids someday too. If you want kids, I realize that's a big assumption, but yeah, the fiance is in the room right now. He's in the chair with his arms crossed, pouty face. So we're gonna move past that topic. We're going to finish Gabbi off here with some MRT into the left scapular region because, again, that's where her issue is. So MRT, myofascial release technique, the idea is that we are going to shorten the muscles so the levator scap extends, rotates like that. I'm going to take a pin, keep your head like that for me, keep your head like that, and up too. I'm going to take a pin, also known as my elbow or olecranon process, put it right there. I'm going to ask you to slowly look down and to the left for me. Go ahead. Is that okay?
Mm-hmm.
I must be doing it wrong then, because usually this is painful. Oh, you should look up and to the right.
Up and to the right.
Yeah, come right back. And now again, slowly down to the left. Oh, there we go. Good. Up to right. Down to left. FYI, MRT isn't supposed to always be painful, audience, just before one of you thinks. Good. Up and to right. Oh, sorry, I don't want to pull the hair. That is actually painful. Down to left. Good. And up to right. Down to left. Nice. Face forward. Please tilt your right ear to your right shoulder. Now slowly tilt your left ear to your left shoulder. Good. Right to right. Left to left. Right to right. And left to left. One more right to right. Left to left. Good stuff. And let's even it out. We'll do the other side too. Up and to the left, please. And slowly down to the right. And up to left. Down to right. Up to left. Down to right. And up to left. Down to right. Good stuff. Face forward. Please tilt left ear to left shoulder. Right ear to right slowly. Good. Left to left. Right to right. Good. Left to left. Right to right. And left to left. Right to right. Awesome job. Gabbi, how did you find all of that?
Great.
Great. I'm happy to hear. You seem like you're a little sleepy. Much like the fiance was. It's the tools, guys. I swear they will knock you right out if you've never had them before. How's the neck feeling rotation wise?
Honestly, a lot better.
A lot better. Actually, I didn't do a retest. Go ahead.
Oh.
Can you go ahead and rotate as far as you can to the right for me right now. We're getting to 90. So that's really, I'm happy to see that. That tells us we're on the right track. And we just needed a little bit of a correction to open that back up. When you do get spasms like that, it's good to get them released. Obviously, like now you have full range of motion.
Yeah.
It comes back. Okay, so getting it released several times off the start is typically all that's necessary in order to relieve it. You don't need a big ass long treatment plan for whatever reason. I'd say we could probably have this resolved in 2 to 3 weeks because you're young, you're healthy, and it was an exercise induced thing. You're gonna get back to exercising. So not serious at all. Again, I'm happy to hear that. Do you have any other questions for me for today, or?
So if that were to happen again in the gym, do I wait a certain amount of time and then come here?
You can come in right away if you like to. So like in cases of like acute neck spasms and pain, there's nothing wrong with getting an expert, someone who's qualified to look at it immediately so they can kind of give you your play-by-play, right? Now, if you are like in the acute stage of pain, yes, you do have more inflammation. Yes, that makes it harder to move the neck and more painful. Sometimes it's prudent to do treatment right then and there. Other times it's sort of like, hey, throw some ice on that. I'll see you in 48 hours or whatever. Yeah. But in the case, like it's good because then you could be missing, low power mode. We're going to go ahead. Do you mind hitting close on that for me right there, fiance, please? No, on the phone. On the phone. Right there. Perfect. Thank you. iPhone programs their stuff to die, and now I'm probably demonetized because I just said that. Anyways, it's good to get an opinion on this, okay? Because they should be able to help you faster than you would be able to just by yourself, right?
Okay. What would your opinion be if I did like pull something like that in the gym? Do you just stop working out completely?
Yeah. So in cases like that, I usually do recommend that you just like put a pause on it, and the reason for that is because you don't know if you've done something serious or not.
Yeah.
Okay, you don't have the background knowledge to be able to identify like, oh, it's just a casual muscle strain, I can maybe go do something else, versus, oh, I just blew a disc, like in a low back, okay? Only people who've gone through the schooling, gone through the education, they can make that call, all right? For myself, okay, when I do get injured in the gym, because it happens, all right, I usually, even if it is still just a muscle strain, hands off, I'm done. All right, and the reason for that is because if you are injured in some way and you want to keep moving, like movement is good, but if you're loading up that movement, you're going to be moving in improper ways. Your biomechanics are going to be thrown off, which will then expose you to further aggravation of injury. You get injured again, suddenly you're looking at a long-term recovery rather than just like, I need 2 weeks off, right? So I don't think it's worth the risk. Typically, I'd say like, hey, just take it easy. If you are an expert, you can keep working through it if you want to, but again, I wouldn't recommend that. Any other questions?
I have one about sleep.
Sure.
Is there a certain position you should sleep in if you have problems with your neck?
Yeah, so the most important thing about sleep is that whatever position you end up in lets you get restful sleep. Okay, like it's not... Yeah, the biomechanics of your neck come into play, and there are definitely some positions, such as sleeping on your front, that aren't great from a you sleep on your front, don't you? That aren't great from a biomechanics perspective. But the most important thing about sleep is that you feel rested afterwards, okay? Because that's going to make sure that all the physiological processes of your body continue to function, including the healing and recovery of neck pain itself, all right? But that being said, if you're sleeping on your front, you have 2 options, okay? You can either lay like this all night, or you can lay like this all night. All right, you take your pick. Either way, you're craning your neck into 90 degrees of rotation for 6 to 8 hours.
Yeah.
Anybody's going to wake up and feel a little bit stiff, sore, if not outright in pain after that. Okay? So usually when somebody's like, hey, what position should I sleep in? My answer is whatever's most comfortable for you, and maybe not your back. Or excuse me, maybe not your front rather. Okay? So if you can only get restful sleep on your front, sleep on your front. All right? But I would recommend trying to sleep on your side, trying to sleep on your back. You can
your
use
side is good?
Your side is okay. Yeah. So some people are concerned about like so many people put like emphasis on like neck position with sleeping. The only thing that's important is that you're comfortable. Okay? Again, outside of that extreme range of motion. So if you are sleeping on your side, you want a pillow that supports you in about neutral. You don't want to be too far tilted this way. You don't want to be too far tilted that way. Just nice and neutral. That's what you want. Some people find an orthopedic pillow. That's one of the ones that are curved. Present a good way to support that neck. But yeah, that would be any position except your front is typically my recommendation. Okay. Yeah. Any other questions?
I don't think so.
No? All right. Well, if you do, feel free to email me or you can message me. No problems there. Wanted to thank you again for coming in today. Really, really appreciate that. And best of luck in the gym and all of the things.
Thank
all right.
you.
Take care.
Don't forget to like, comment, and subscribe.
Thank you, Gabby.